We are here at San Francisco, California's Bayview Opera House for a community screening of The Waiting Room, also with a follow-up discussion with a diverse panel. We want to have a community discussion on how healthcare reform is going to be changing the community's outlook and changing how healthcare's outlook will be. And so we'll be having some guests speak on that as well. So I'm Dr. Marcus Lorenzo Penn. So we're joined here by Tanya Leake of the Network for a Healthy California African American Campaign, Bay Area region. So we're here to talk about healthcare reform, also in the context of the waiting room. Now, I know that your organization does a lot of work with hospitals, and so you form that bond real close. So could you share with us how those connections work with your organization?
Sure. The Network for Healthy California is responsible throughout the state of California for really addressing the health disparities within low-income communities.
Mm-hmm.
My focus is the African American community. But one of the things that's really important as part of that is working with direct health service providers, those institutions that are bringing health and health information to their clients, their customers, et cetera. So I focus on working with them and partnering with them to bring nutrition education as well as physical activity education to their constituency. So I partner with them because they have the audience that we can bring some of our resources and materials to.
Now, with the healthcare reform law always about getting languaging correct, has your message shifted more with the healthcare reform law unfolding?
I don't think so. I think because the focus really has been low-income folks were part of the push for healthcare reform, not those folks who were not covered. And interestingly enough, because of the health disparities that we've seen, those folks are actually in the most need for healthcare. So our messaging hasn't changed. I mean, we're still focused on, we really want to change the disparity that exists between those of lower income with their health outcomes. So that's continued to be the focus. We're excited that healthcare reform is now going to help us with that.
And do you work with all age groups?
Yes, we do work with all age groups. The Network for Healthy California actually has a number of different programs. The African American Campaign is one. We actually have a power play campaign specifically focused and targeted at youth. And we have a Latino campaign. So we are targeting a number of different ages. For the African American campaign, we really try to address families because we know that when you have those messages within the family structure, that tends to provide a little bit of peer support as well as encouragement, amongst the family members. So.
Well, building community is huge. It's so huge. We just had a gentleman, Jeffrey Betcher, speak about community gardens. Is there, as there's health in fruits and vegetables and eating better in communities, is there advocacy for community gardens as well?
Of course, of course. One of the things that we tend to, just generally, partnerships are extremely critical for the network. Again, we have what is ultimately funding for resources, both people and materials, to bring to our audiences. Our partnerships with community gardens, as well as we have master gardeners that we work with the UC Cooperative. So we really try to, in our education sessions, actually include modules that are specifically focused on how to start and maintain community gardens.
What have been some of your most popular programs and most well-received programs?
Ooh, that's a hard one. I will say that one of the most impactful modules that we have, especially around education, is our sugar module. So we have something that we call our Rethink Your Drink, Sugar Savvy module. Now, sugar is present in a number of different foods and drinks.
Sometimes called a different name. High fructose corn syrup.
And that's part of the module. And what's really interesting is how surprised people are to find out how many different names sugar goes under, and also to find out how much sugar is in, especially some of their favorite drinks. So when we talk about, some of the, I don't want to name any drinks. The USDA doesn't like that.
No problem. No problem.
But, when you talk about the American Heart Association recommending that we consume 6 to 9 teaspoons of sugar daily, what you find is that most of the drinks that are sugar sweetened have more than 6 to 9 teaspoons. So you're done with your daily allotment by the time you have your 20-ounce beverage.
Speaking about sugar and how having too much can lead to diabetes and have folks with crises to lead them into the ER, Kind of leads us to our movie screening, the waiting room, trying to decrease more ER visits for, diabetic ketoacidosis, diabetic, low sugar, all of that. How do you see your organization helping to just impact healthcare as a whole?
I think we help impact healthcare by really providing awareness for people. I mean, our focus really is education, and we tend to state it as empowerment, because I think once you know, you can act. Now, again, that's always a choice, but we are really focused on education. So I think as it relates to diabetes, we've, again, been partnering with a number of organizations that do education in a number of different ways. As a member of the African American campaign, we've been partnering with some youth organizations that do spoken word.
Yes.
So there are ways in which I think we can really get the message across that are really important for especially African Americans to take that message and understand what it means to have diabetes, the risks that are there, the contributors to getting diabetes. So all of those, I think it's about information, and that hopefully will lead to a decrease in a lot of these, sort of conditions that are the result of people not really taking care of their diabetes if they have it, and also hopefully stopping the trend of increasing amounts of cases of diabetes.
Okay. Thank you so much for speaking with me.
Thank you.
Indeed. I really hope that the network grows and grows, and I really appreciate the programs that you bring to the community.
Thank you very much.
Appreciate it.
Thank you so much.